How are we doing thus far?
So from 0 to 10, I can tell you right now, I feel it's 1, you know?
Great.
Yes.
Great.
Totally.
Okay.
Like, I used to wake up before with like this very weird pain in the back, in the lower back. And I was just like trying to stretch it out and stuff. The past 4 or 5 days, I just wake up with very, very, very little pain.
Hello YouTubers out there. So we've got Alberto here that came in to see me. He has some lower back pain on the right side. How long did you have the lower back pain for?
Around 4 months since the entire quarantine started, basically.
Okay, so a lot of people, even if you're working out at home during coronavirus, a lot of people are more sedentary. It's just a fact. I don't care how much you're working out and exercising, we're all in our homes much more, especially here in New York City in March, April, May,
right.
And even now, June, July, people are kind of staying to themselves.
Absolutely.
So he developed some lower back pain on the right side. He's also a cyclist, so you've also been cycling around, so you don't, when you do go out of the house, you're biking around, is that correct?
At all times, yes. I never leave my house without my bike.
Okay, so we're on visit 3 here with him, and how are we doing thus far?
So from 0 to 10, I can tell you right now, I feel it's 1, you know?
Great.
Yes.
Great.
Totally.
Okay.
Like, I used to wake up before with like this very weird pain in the back, in the lower back, and I was just like trying to stretch it out and stuff. The past 4 or 5 days, I just wake up with very, very, very little pain.
So he did the right thing. So he had low back pain 4 or 5 months ago.
Right.
He started to stretch regularly.
Right.
So why don't you tell them about what you did on your own before you came in, and then that prompted you to come in, because this is important. If you have back pain, it's okay to stretch for a week or 2, and if it's not improving though, that's the point to kind of come on in and have that looked at professionally, whether it's a chiropractor, physical therapist. I don't know if I would go to my internist or my general physician, but certainly a chiropractor or a physical therapist or an acupuncturist, if at that point you're still having back pain after stretching. So how many weeks, how many months were you stretching for?
Basically since March. Since I started feeling that lower back pain, I was like, oh my god, no, like it's something is weird. And I just started stretching. So with this stretching period of time, I started feeling like it was getting a little better, but it just never went away.
Okay.
And it kind of like, at that point, I was like, oh no, I need some professional just to go ahead and see me, and then I was looking around. I posted something on Instagram actually, and
okay, we appreciate that.
And Dr. Marine, she just posted right back to me.
That's right. You were referred by he was referred by his acupuncturist because he had some subluxations in the spine, and we're going to correct that now. We'll show you how we do that. Go ahead and lay on your stomach.
Right.
And the acupuncture, I'm sure, helped you a bit too, right?
Right.
Just had some subluxations in the spine that we need to correct for him to completely heal. And now that's happened, and you're going to do great from here on out.
Nice.
You're going to bike today? It's going to be 75 degrees today, I hope so.
It's going to be beautiful, yes. I'm going to bike a little bit today. Tomorrow I'm going to the Bear Mountain.
Bear Mountain ride tomorrow. So that's a 130-mile bike ride. This guy's going to do 130 to 135-mile bike ride to Bear Mountain from Manhattan to the top of the mountain and back. I've done that once, and when I got back to New York, I was delirious. It's a tough ride. And all you do is take a few breaks, stops on the way, right, for 5-10 minutes.
It's a
tough ride.
Granola bars and water, yes.
Yep, and a lot of granola bars and water and Gatorade. All right, so we've got Alberto here. We're going to go ahead and adjust him, get him ready for his big 120-ish, 30-ish mile bike ride tomorrow.
Probably.
And are you going to bring cookies with you tomorrow? So you got Cookie Monster right there.
Cookie Monster right here, I love it.
Cookie Monster rules. You're going to bring some good high-calorie cookies with you. Stick them there in the back pocket.
Granola bars, yes, for sure.
There you go. All right.
Oh.
Okay. Now, other side up. So he had one pelvis higher than the other.
Which one was it?
And
this one?
your left one was pulled down and back. Your right one was higher and forward.
Oh.
And I'm referring to the back and top of the pelvis, because the pelvis is, you get the top and the lower portion. So if you're, it rocks, right? So if you're talking about the bottom, it would be totally different, right? So when I refer to that, I mean the top joint. So it's moved down and back on the left, and forward and higher on the right.
Wow.
Does that make sense?
Yes, absolutely. By posture or by
Torque. That torque. So.
Okay.
And oftentimes that's the case, but sometimes people are really flat-footed. You'll see both hips lean forward, or somebody that's overweight and got weak abdominals. Not the case for you, but they'll have forward pelvic tilt on both sides. Not the case. It's more on your left side. Okay, great. And on your stomach. Now, what do? You use a road bike for this mile, for this
No, dude, no.
trip,
that same tank.
that same bike?
Same
Okay.
heavy bike.
What is that, a cyclocross? Or?
It is a cyclocross.
Okay. Oh, wow. So he's doing 100, that's even
Harder.
tougher. I've done the same exact trip, but on a time trial, on a triathlon bike where I had the elbows, I could rest,
Right.
He's doing it on, you got road bike handlebars, but it's a cyclocross, so
Yeah, thick
the
tires.
wheels are thicker. It's a harder ride, unless you hit some trails on the way. Are you going to go off-road, or?
Trying to do
Okay.
the OCA, the old aqueduct on the way down.
Okay, on the way back. So after about 75, 80 miles, then it gets a little bit of trail, right?
Right, yes.
Okay, so probably only about 10% of the ride is going to be on trail, correct?
Yeah, it's mostly pavement.
Mostly pavement, yeah. That's tough
It is tough.
on a cyclocross bike. I give you credit. All right, keep your legs straight. Raise one leg as high as you can. Good, and down. And the other one. Okay, is one leg harder to raise than the other?
Maybe the right one, yeah.
See that? I put my hand up. His left leg went up higher than his right. So he was right. He sensed that the right one was a little harder to raise.
Right.
But his range of motion is much better than it was when he initially came in. We're going to cross this ankle over here. So what this means is it tells me that his sacrum is rotated. So we're going to go ahead and adjust the sacrum. So his sacrum is actually rotated counterclockwise. Okay, uncross that leg. Now go ahead and raise them up one at a time.
Ooh, I'm sorry.
Okay, let's try that again. That was fine. You didn't hurt me. Usually people kick me when I'm already down. You got me when I'm up, huh? Good shot.
Did I kick you?
All right,
Sorry,
and the other side up. Okay. Still, this one a little bit higher, so cross this ankle over here again. Take mixed martial arts too, huh?
I did when I was a kid, not anymore.
You still got some skills. You got me where you got a headshot in there.
I'm so sorry.
Good thing you didn't have your cycling shoes on. I might have been on the ground.
No.
Okay, go ahead and now try again. One at a time. Just raise your leg, not your whole hip and pelvis. Just the leg up. Yep, and down. The other one. Perfect. Now it's just right. So you just had your sacrum was a little rotated there, okay? All right, now turn over on your back. You've got a couple of anterior subluxations here in your middle back. That's why that's a little sensitive there.
Right.
Flip over on your back, please.
It's amazing. And you can sense it. Love it.
Yeah, I can feel it right away.
I mean, the moment you touch me, I'm like, yeah, and you said you feel sensitive, and I'm like, yes, I'm feeling sensitive inside, so it's...
Yeah. I can sense it because your vertebrae are a little bit out of place, and I can feel that they're subluxated and out of position. A subluxation is a misaligned vertebra,
Okay.
right? And that misaligned vertebra can irritate and chafe a nerve, and those nerves go to muscles, organs,
That's
cells.
beautiful, man. So that's very nice that you can sense that. It's amazing.
Cross your arms, give yourself a big hug. Good. Tuck your chin down. Deep breath in. And Okay, good. A lot of people ask me if this hurts my hands. No. But I will probably pay the price.
Down the road?
You know, yeah, 10, 15, 20 years from now. I'm 20 years into practice. I'm sure it will catch up to me in the form of arthritis in my hands. Hands up in the air. Last time I saw you, you had a tight psoas, and today it's good. Excellent. I wonder what your psoas, though, is going to be like after that 125, 30-mile bike ride. That'll be something to check next week. So
absolutely.
You're going to do the ride tomorrow. I'll see you
Yes.
next week after the ride. And that's something we definitely want to check.
Perfect.
And if it is tight on one side, we need to take a look at maybe your bike. And have you had a professional setup on your bike?
A
You
better
have.
adjustment? Yes. I
You
have
okay.
not. I have not in a long time.
Have you moved anything from when they did? You know how they
No,
set you
but
up on the
things
bike
move-
and line up your seat?
Right. Yes. I did it when I first got the bike, but not in a period, in a time frame of maybe a year. And you know how
should be-
things move a little bit. You know.
Yeah, you should be okay though if you had it done like a year ago when you got the bike.
Right.
As long as you did it properly. So you need.
I mean,
a bike fit is pretty scientific these days when they
it
bike
is.
fit you.
300%. Yes.
So if you had it done properly, it should be fine. But we'll check your psoas on Monday next week. All right.
Perfect. Thank you
All
so
right.
much. Appreciate
Come on
that.
up from the sideline position.
From this side.
Yeah, then push yourself up. There we go. All right.
Thank you. Thanks, man.
You're welcome.
Oh,
Enjoy that bike ride.
feels amazing. It feels
Good.
lots of relief.
Good. Good. All right.
Thanks a lot, man.
Appreciate it. All right.